Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look at some specific antidotes. Antidotes and for the poisoning. So to begin with, we look at the poisoning of methanol and ethylene glycol. So methanol and ethylene glycol, the antidote will be the 4-methyl pyrazole. So it is nothing but the 4-methyl pyrazole. Next, we move on to the carbon monoxide cyanide and methemoglobinemia. So there, it's simple. It is just 100% oxygen. Next, when you look at the amphetamine and the phencyclidine, it is the ammonium chloride. Then when you look at the cyanide and hydrogen cyanide, it can be amyl nitrate, as well as there are some other compounds as well. Carbamate and organophosphorus poisoning, it is atropine. Atropine can be given in case of the carbamate and organophosphorus poisoning. Then nicotine, the thing being bupropion. Next, looking at the calcium, cadmium, chromium, cobalt, lead and magnesium, nickel, uranium and zinc. So these are all metals. So for this case, we can give the calcium disodium. So calcium disodium edetate. Next, we look at the calcium gluconate. So calcium gluconate is an antidote for which precipitates fluorides, magnesium and oxalates. So calcium gluconate is used in this case. Next, we look at the iron and aluminium is diphosphoroxime, and amphetamine, chloroquine and alcohol withdrawal, it is diazepam. Diazepam, where it is used, amphetamine, chloroquine and alcohol withdrawal. Then let's look at the dicobalt etidate. The dicobalt etidate can be also given in case of cyanide. Earlier we saw cyanide, we also have amyl nitrate, and cyanide also the dicobalt etidate can be given. Next, in case of metals such as arsenic, copper, lead, mercury, nickel, there is dimercabrol, that is also known as the BAL. Then moving on to the phenothiazines and related drugs. So phenothiazines and related drugs, there can be the diphenhydramine. Diphenhydramine can be administered. Then looking at the disodium calcium etidate. Disodium calcium etidate. Disodium calcium etidate can be given for lead. Then mercury, you have DMPS, that is unithiol. Then lead is DMSA. Then looking at the copper, mercury, chromate, zinc, sickle, they can also be the D-penicillamine, which can be given. So methanol and ethylene glycol, the easy, it is going to be the ethanol which can be administered. Next, moving on, after we discussed about the ethanol, the FAB fragment. The FAB fragment is given in case of the digoxin, digitoxin and the oleander T. So FAB fragment, where is FAB fragment given in case of the digoxin. Now the flumanazole is given in case of the benzodiazepines. The glucagon is given for the propranolol and the other beta blockers toxicity. It is glucagon. Next is the look at the cyanide. So cyanide, we have seen so many. So there's also the hydroxycobalamin which can be used, and the hypertensive crisis due to cocaine. So due to cocaine hypertensive crisis, what is given? Due to cocaine hypertensive crisis, there is a hydroxycobalamin. So hydroxycobalamin is the one which is given. Next is labetalol hydrochloride. Labetalol hydrochloride is for hypertensive crisis, where we discussed, and hydroxycobalamin is for the cyanide. For the cocaine, the hypertensive crisis for cocaine, it is going to be the labetalol hydrochloride. So labetalol hydrochloride is for the cocaine. and hydrocobalamine is for the cyanide. Next, moving on, we look at the methoglobinemia is for the methylene blue is used, paracetamol is methionine. Paracetamol, what is used? Methionine is used. Methionine is also used. Next, the paracetamol acetaminophen toxicity, N-acetylcysteine, that alporphin is given in case of morphine, then naloxone is given for the narcotics, opiates, CNS, and depressants. Then nicotinamide. Where is nicotinamide given? Nicotinamide is given in cases of the vacuum poisoning, the phenylurea, and the pesticide toxicity. Now, moving ahead, we look at the pancuronium bromide. Pancuronium bromide is given in case of the neuromuscular blocking agents. So, what is given in neuromuscular blocking agents? It is the pancuronium bromide. Then, in case of copper, it is a penicillamine. So, what do you do for copper? It is penicillamine. And the coma convulsions anticholinergics, you have physostigmine salicylate. This is in case of coma or the convulsions from the anticholinergics. The pralidoxime is given in case of organophosphorus poisoning and nave agents. The propranolol is given in case of cocaine intoxication. So propranolol is given in case of cocaine intoxication. Then moving on, we look at the heparin overdose. You have protamine sulfate. This is important. Heparin overdose is by the protamine sulfate. Next, moving on to the heparin overdose, protamine sulfate. Thallium is Prussian blue. Thallium is Prussian blue. And pyridoxine is isoniazid hydrazine toxicity. You have pyridoxine. Then pyridoxine, that is a vitamin 6, is given in case of isoniazid and hydrazine toxicity. The sodium bicarbonate is given in case of the urinary alkalization for the salicylate as well as the phenobarbital. So, where is sodium bicarbonate given? So, where is this given? Sodium bicarbonate is given in cases of the urinary alkalization for the salicylates as well as the phenobarbital. Next, the cyanide we saw so many times. So, we are repeating cyanide. We have the hydrocobalamine. For cyanide, we have cobalt etidate, then also the cyanonitride and the sodium thiosulfate. So there are many drugs which can be administered for the cyanide. Then looking at warfarin. So warfarin, what is the drug? What is given for warfarin? So warfarin, it is always the vitamin K which is administered. To learn and grow daily like this, please do subscribe.